So welcome to the April 14, 2016 All Provider webinar. So today's agenda is we'll do some state updates, treatment prevention in general, and then we have a presentation by Thais Broddick from the Oregon Lottery telling us about their updating us on their ongoing projects and their new projects. Then we're going to talk a little bit about helpline data in the GEAR program, and then we'll talk a little bit also about the Problem Gambling Services implementation work plans that were sent out for review a few weeks ago. Next slide. At the end of this webinar, for those of you that are attending, we will send the PowerPoint and any accompanying documents out along with a CEU certificate via email. So you will either receive that later this week or early next week from Patricia Alderson. Additionally, for those that don't attend, we also send this PowerPoint and the recording of the PowerPoint out to all of our providers. Next slide. Okay, so the first update is I just wanted to let you know that there's still time to register for the Focus on the Future conference. This is a conference with a collaboration between Oregon and Washington, the Evergreen Council and the Oregon Council, and also our office. So there are 2 days of pre-conference workshops and 2 days of general conference. It's located up at the Crown Plaza in Portland. And here's a link. If you haven't registered and still interested, here's a link to get to the registration form and information on who's presenting, what topics are being presented, and to see if you want to attend. We have a pretty good attendance. I think the last time I heard from Evergreen Council was a couple days ago, and we have about 120 registrations from Oregon, so that's really great. So that, I think registration is open until almost up to the day that the conference starts online, so it just gets a little bit more expensive as time passes by. So if you're interested in going, register as soon as possible. If you have any questions, you can let Roxanne and I know. Next slide. Also just wanted to let you know that if you are registered for the conference, you're going to receive an email from me early next week just telling you about that there's a special Oregon breakfast on Friday morning from 7:30 to 8:30. And we don't know exactly what room that's in, but there'll be signage at the hotel to direct you. And we're going to be giving a few updates, but mostly this hour is just going to be spent with the PGS state staff and also our evaluation contractor or the Executive Director of the Oregon Council, Tom Moore, just kind of cruising around the different tables that you're eating at and just touching base with you. We're going to use it as an opportunity for networking because sometimes at the Evergreen Conference, there's not a lot of time to network with Oregon-specific providers and the state staff because we're just moving from one workshop to the next. So we're going to use this time, this 1 hour, to provide you that opportunity. So hopefully you'll get up a little bit earlier than the conference starts and attend that breakfast. Next slide. So our next All Provider webinar will be June 16th. And this is the web link to register. And we'll have an agenda that come out probably around the middle of May just to let you know what items might be covered. But I also wanted to let you know that we've developed the 2016/17 training calendar for monthly prevention and treatment calls, All Provider webinars, anything else that we knew was already planned for this time frame. And that calendar can be found on the Oregon PGS website as listed at this web address. So I encourage you to go onto the web address and either download the whole training calendar or just look at it on the web page and mark these important calls and webinars and other things on your calendar so that you have a hold in case you're interested in attending. Next slide. So I just wanted to let you all know that there's the national conference is coming up in Tarrytown, New York, and registration is now open. So there's a link to the registration and for more information so you can see what presenters are going to be presenting on if you're interested in going. So it's a 2-day conference, July 15th and 16th, and then a 2-day pre-conference also on July 13th and 14th. So feel free to use your problem gambling treatment and prevention funds to attend that conference if that is how your agency, if you have that kind of those funds available and your agency is willing to support that. Next slide. So I also wanted to let you know that we are planning, the PGS staff here at Oregon is planning on having an Oregon PGS provider annual gathering or meeting. We're not sure exactly what we're going to call it, but it's like a conference on September 29th and 30th at Eagle Crest Resort in Redmond. So we have the dates and the location set, and we're working on bringing in some speakers. We're looking at speakers that will be of interest to both the treatment providers and the prevention providers. So we should have that pretty much finalized maybe by the end of this month, hopefully. So mark your calendars for these dates, and then we'll have more information that should come your way by mid-May. So this is our Oregon-specific annual conference that's going to be happening in 2016. So, next slide. So one thing I did want to let you know, and if Tom Moore was on the phone call today, the executive director of the Oregon Council, he would tell you this, but he's, I think he's out of state at a meeting. The Oregon Lottery and the Oregon Council on Problem Gambling submitted a proposal to have the national conference in 2017 in Oregon, and we were accepted. So, so we'll be having the national conference here in Oregon next year. I'm kind of guessing on the dates of this slide, but I think I have it correct. I think the dates will be July 14th and 15th, with the pre-conference on July 12th and 13th, and it's going to be at the DoubleTree in Portland by the Lloyd Center. And so we're going to have a lot more information coming out on this in the near future. We were just accepted about a month ago, so it's all fairly new to us right now, so we'll be giving more information out, but I just wanted to make you aware of that and let you know of that, just in case you had heard that through the rumor mill. And that because the national conference is coming to Oregon next year, that's the reason we decided to have a Oregon-specific conference in the end of September. And next year, in 2017 calendar year, we won't be having any specific Oregon-specific conference. We might have some regional meetings and other smaller trainings, but nothing large, because we're going to be focusing all of our attention and energy on this national conference and making sure that all of our providers here are supported if they're wanting to attend that. So just to be aware of that, that's coming up. So just ahead of mark your calendars for that too, potentially, and a lot more information will be coming out about that conference in the near future. Next slide. Okay, go ahead, Roxanne.
Okay, so here, thanks, Greta. And so for the prevention updates, I wanted to remind folks that on the months that the all-provider meeting is occurring, we do not have a prevention connection call, so they'll alternate off of those months so that people can participate in the all-provider meeting. So our next call is on May 12th from 10 a.m. to 11. An email link will be for the call will be sent out the week of May 2nd for that. It's also on the training calendar as well. So the reminder that you can always check the training calendar for information about upcoming meetings. And then wanted to let folks know that in our partnership with Public Health, they are just getting ready now. They had to hire a new health analytics person for their team. They've got him onboarded, and so their first project will be cross-tabulating the Oregon Healthy Teen Survey data with the other risky behaviors that are in the Oregon Healthy Teen Survey. The data will tentatively be available for release in June, but if you have not already gone on and looked at the Oregon Healthy Teen Survey data information from 2015, the link is here provided for you so you can check it out. That's where you can see the gambling specific questions, but you can also look at the other data as well that's included. So the project that Public Health will be doing for us has been to cross-tabulate that data to show the non-gamblers versus youth that are reporting gambling versus not reporting gambling against the behaviors. Okay. More to come along those lines with that. Excited to get that data for you folks here real soon. Wanted to also let folks know that the Prevention Summit is scheduled for May 17th through 19th in Eugene at the Hilton. Problem gambling prevention will not have a specific breakout during the summit. However, there will be time on the 19th to review and discuss the Oregon Prevention Data System, so PGS, and we'll be looking at time feedback, etc., and there'll be some networking during the time frame as well. So come prepared to talk about any questions you might have about how your data is going into the system, and we'll also be looking for suggestions on changes to the system that we potentially could put into place. So anyway, May 17th through 19th, and if you have any questions about the summit, please feel free to go ahead and give me a call, or you can contact your state substance abuse prevention coordinator as well if you are receiving those funds. And last but not least, wanted to just kind of do a brief shout out that the Problem Gambling Adolescent Prevalence Study is underway this month. So we've been working hard with our providers, our provider who's going to be conducting the survey for us, to get the questions updated, because the last time the prevalence study was done in 2007, the world has changed significantly since then. And so we've had to update, but we're also trying to make sure that the questions that we would like to be replicated would be replicated. So we have finally, knocking on wood, as long as Dr. Goldberg approves the survey, got a final draft, and the calls should be starting next week. We've been testing it so far this last week, and they're actually a special training today. So we should have data coming our way from the adolescence prevalence study in the fall. So more to come on that, and it for my update. So we'll move on to Greta for the treatment updates.
Thank you, Roxanne. So just wanted to let the treatment people know that there's a treatment call on May 4th. It's 3 to 4, and the email agenda will be sent out early next week regarding that. And similar to what Roxanne reported on the prevention calls, when there is treatment call in the same month as the all-provider webinar, we did not have a treatment call that month. So we tried to free up some of your time and not overburden you. And so when there are all provider webinars, there are not prevention or treatment calls in the same month. Also, just to remind you again that the GPMS forms were updated on February 1st, so please start using those forms immediately. We updated some of the values, created some new questions that we felt needed to be asked, and also eliminated some that we felt we didn't need anymore. And so you can find all those forms on the Oregon PGS webpage at the website link listed. And then I just wanted to let you know that we were translating the family gambler and the client gambler surveys and the family and client satisfaction surveys into Spanish, and I did receive those earlier this week. So they are completed, and I will put them on the Oregon PGS website sometime next week and send out an email about that, so you can download those if you want to use those new forms that now will be similar to the English version. So that's great news. And then lastly, on this slide, I just wanted to cover that we have some new program policies, guidelines or statements that we developed. One was on online counseling guidelines, so it just kind of walks you through what, if you're going to be using online counseling, what are some stipulations that we'd like you to follow, and also a policy or guideline statement on concurrent services at multiple agencies. So when you have a client who is enrolled at multiple agencies at a time, possibly due to traveling for work, temporary relocation, they can be, a client can be open at 2 agencies at the same time. And so we just laid out some policies of how we would like that to, the guidelines about how we would like that to work. So you can see all of those policies on the Oregon PGS webpage that's listed on the slide. And if we move to the next slide, Roxanne. I just wanted to, so I really want people to start using the Oregon PGS webpage if they haven't, and just become kind of familiar with it. We have spent some time updating it, and we're going to continue to spend some time updating it and populating it. And I just want to give a shout out to Julie Hines for all her hard work on making these edits and these all these changes that we want on the webpage and posting stuff to us. So here is the policy statement page where you can find the concurrent enrollment, and you can find our statement on the DSM-5, also on the online counseling guidelines, and also on internet gaming treatment. So these are the policy statements and guidelines that we have put out over the last couple of years, and these can all be found under, for the treatment providers section, under policy statements. Next slide. I also just wanted to let you know that we, as we stipulated earlier in June, or July 1st, we started a performance-based contracting metrics and system. So we looked at data, these 5 data points over the last 6 months, and if they were met, agencies or our contractors were given 1% of their funding for each metric that they met, and those performance-based contracting funds went out, or your program management side of whether you were going to receive any of those metric funds last month, and so your agency, if they did, would receive some in the very near future as soon as contracts are amended. So if you're interested in knowing if you received any of those, you could contact your program manager, or you could also contact me and I can let you know. But I also wanted to let you know that we will be looking at these same metrics again in October. So we're going to be, so we recently looked at them for July 1st through December 31st of 2016. And now the next time we do a review of these same metrics, it will be for July 1st of 2016 through June 30th of 2017. So I did that backwards. Let me say that again. We looked at the data for July 1st of 2015 to December 31st of 2015. And when we look at the data in October again, it will be for July 1st, 2015 through June 30th, 2015, just like the slide says, not what I said. So we'll look at some of the same data again. So if you might have just missed the mark slightly, you have another 6 months to try to bring your percentage up to get that allocation. And so just something to be aware of. And if you ever have any questions about how you're doing on this, you can always request that data from Tom Moore at Herbert & Lewis, and he can let you know. So if you have if you want more information on the performance-based contracting metrics, you can find that also on the OregonPGS.org website. Next slide. So that is all of our announcements for the state updates. I will let you know that we did get an email this morning from Julie Hines, who does a video contest around Problem Gambling Awareness Month, and she wants us to send out the top 5 videos for voting to all of you guys, all the providers, so you'll have the opportunity to vote. So Roxanne will do that probably later today or this week to allow you to have that opportunity, because I know how much people like to see the creative minds of our young adults and be able to actually take part in selecting winners and just see what great art they can come up with. So if there's any questions about state updates, you can go ahead and type those into your question box, and then Roxanne will probably respond to you, or she'll read them out loud, and we can cover them all together. Otherwise, let's move on to respect Thais' time at the Oregon Lottery. So next slide, Roxanne. So Thais is here today, and I don't know if Stacy's on the line with her, to present Oregon Lottery project updates for us. So go ahead.
I think we are. We're both here. Can you hear us okay?
Hopefully, yes, I can hear you.
All right, perfect. I know we were having some technical difficulties. So thank you, everyone, for having us on the call. We have a pretty robust presentation today, lots of information to share with you, but all really great information that we hope you will find valuable as well. So we'll start off by sharing the new couch spots, and if you could, here's our topics for today. We're going to be showing the two TV commercials for the couch. There are new problem gambling TV spots, and then the radio spot that also mirrors the campaign, and it's been airing since mid-March. We'll show you what the media support is for all three of these efforts. Then Stacy is going to walk you guys through the new training modules that we have developed here at the lottery. I'll touch briefly on multicultural outreach and the new collaterals we have produced, but are still waiting on feedback and approval. And then we'll share opgr.org stats for February and March, since the last time we presented was during the February 18th meeting. So next slide, please. You will see the couch, and I would like to play the spot in its entirety. It's for the problem gambler's perspective. That's this version. And we haven't aired it yet. We started with the significant other, so this is brand new to you. Were you able to hear it? Did you on your version or no? We're not hearing audio on our version, so we can certainly share the links if you weren't able to hear it. They're up on YouTube. But let's see the next slide, a significant other. Are you able to flip to the next slide, Roxanne or Greta?
Working on it. I see.
Okay. Were you able to hear the audio on the YouTube? We weren't.
No,
we didn't hear.
I'm wondering if it was because I had my speakers off, though, and now I've completely lost them.
Yeah. Okay. Why don't we? Let's see if we can play the next one. And if okay. Cool.
Okay.
If you touch on the file, it should play. Okay. All right, so we're having some technical difficulties with it playing, but maybe what we can do is when you send the presentation, the links on YouTube will be there, so you can play and listen, and hopefully the radio will play. This is a radio file that's been airing since mid-March. Are you able to play, Roxanne?
So they worked fine when I tested them. So in the PowerPoint, so they're just not.
Okay, can we make them available to? Can we make them available to the? Cool,
Yeah,
thank you. All right, then so you're gonna have to have a little bit more suspense on your end before you can actually see and experience it, but it's coming. In your way, I promise. Let's flip through the media support so you can see what slide is the next slide. So we started them mid-March, and we've just ran the significant other version of the spot during the first 4 weeks, so from March 14th through April 4th. We've been running Mythbusters this week, and we're going to run it again at the end of April, the last week, and that's the responsible gambling spot, and then we're going to pick it up again with Couch in May. And in May through June, we're going to run 50-50, the two versions. So half of the spots will run the problem gamblers perspective, the other half will be the significant others perspective. But both spots, as you may or may not have seen on the quick glimpse we had, both of them have the phone numbers. So, now I'm going to turn it over to Stacy. Hopefully you'll be able to see some of the training videos, but then again, if not, we'll make them available to you.
Great, thank you. Good morning, everybody. It's Stacy Shaw. I want to talk to you about some of the training we've been working on for the past year because it's pretty much about ready to go. And I want to give you some background on what we did. So we've developed an online interactive responsible gambling training module for the frontline staff of our video lottery retailers. And we have approximately 2,400 video lottery retailers, so we're going to be attempting something that no one's ever done before, which is to get to all of the frontline staff. So we developed this with input from video lottery retail owners and the senior management, so we would have top-down buy-in. We also interviewed and had focus groups with actual bartenders, wait staff, and the like. We engaged with industry experts to help us, people who are very good at training. I've done a lot of training for casino and also for video lottery programs in Canada. We interviewed our retailer-facing lottery staff and then various Oregon stakeholders, including some of our friends with Oregon Health Authority. As I said before, it's an interactive and easy to access. It's about 30 minutes, and we are going to have people register via the lottery retailer website, and it's going to be promoted by the owners of these businesses and our lottery staff. We'll be encouraging people to take this training. We're going to pilot it because, as I said, if we conservatively estimate that every one of our 2,400 retailers has 4 employees, which is very conservative, we're trying to train 10,000 people. So we're going to do a pilot first to make sure we've got all bugs out. And our pilot will be the retail locations of our video lottery advisory panel retailers. These are, that represents 250 of our highest volume, highest profile video lottery retailer locations and encompasses pretty much all of the deli model retailers. And we hope to begin this mid-May. And if you can go to the next page, I was going to show you a couple of elements from the training, and I'm not sure if these will work or not, but let's give it a try. The first one is it's called Your Role. Let's see if we can get that. This is particularly unexciting without audio, even less exciting than the television. At least people are moving the television. see that the characters there are making a statement which is responded to in the text bubble, and this is really about getting frontline staff at video lottery retailers to understand their role in promoting RG. So this is just one of very many activities and bits of information found in the video. The second one I have, and I'm probably just going to spare us all watching that, is an actual video that we shot, and it helps to train frontline staff on providing access to help. And in this case, it is a bartender offering someone who's given them the opportunity, offering them a pamphlet on accessing help. And I will assume that the links to this will be made available in the presentation as well. So in addition to the training for frontline retailer staff, we're also working on all lottery staff training. Again, developed with a wide variety of input from lottery player and retailer-facing staff. And then additionally, a lot of other lottery staff that you wouldn't think of as generally having a role in responsible gambling, but we believe everybody here does. And also, we engaged an industry expert to help us train this, build the training. We're going to make this required training, and all of our staff will take it annually via iLearn, and everybody who's involved with the state knows what that is. And we're hoping to begin in June, and we'll require people to complete it by July. And what is there is a video that we've done for this piece of training, and it is shows a lottery employee working on a video lottery terminal and engaging with a player in that format. So that too will be included. You can go to the next slide, Roxanne. But we're not done when we're done with that. So as soon as we complete the pilot for the video lottery retailer training, we're going to figure out what we've learned, make any necessary modifications, and then head out and try and get all of our video lottery retailers trained. We will also be looking at developing some training for traditional lottery retailers, and we will be taking some of the basics that are in the existing training and making it more specific to the situations a traditional retailer would find themselves faced with. We'll be looking to identify one of our chains to pilot this with as the chains, and we'll look for a chain that has a very high energy around corporate social responsibility, and we'll work with them. And I'm hoping that we'll do a pilot in Q4. And I have to say we're very excited about this. This is a huge undertaking, and I think is something that will actually provide some measurable results. So we'll keep you updated on it, and maybe next time we get together we'll have some finished training. We can send you the link to that.
So
Thank you.
On the next slide, this is we had the Problem Gambling Awareness Month poster that said have the conversation. We had that translated into working with Amy Sue, and she asked us to get it done in Chinese and Vietnamese. So in this slide, the posters are in simplified Chinese and traditional Chinese, and she is having that reviewed by the Asian multicultural community folks, so that we make sure that it is saying the proper terms. And then the next slide, we have it in Vietnamese, and that's also being reviewed. And if there is a request, I think there's a request for it to be done in Japanese as well. And if there are other languages that the providers feel that we should be making materials available, we'll be happy to do so. So next slide is so just an update on the clicks to the website. So February, we saw pretty strong clicks to opgr.org with 89,798, with Google having 30,366, and Facebook 59,432. And then March, we saw really huge numbers, and I think it has to do with National Problem Gambling Awareness Month. And that's the next slide, please. We have 35,165 for Google, and Facebook saw a really huge jump from 59,000 to 75,618 in March, and we think it's due to the fact that people are being served more effectively the ads, and therefore clicking to the website. But this is the highest number of clicks we've seen to opgr.org, and pretty timely that it was during National Problem Gambling Awareness Month. So, are there any questions? Sorry about the videos not playing. We'll send links, and hopefully you'll be able to provide your input and whether or not you like the new spot and the new couch campaign.
I'm not seeing any questions at this time, but if something comes to you later, please go ahead and let either Greta or I know, and we can certainly, if we can't answer it, we'll get together with Thais and Stacy and get those answers for you. Oh, something just popped up. Hold on just a second. Oh, we had a comment from Julie Hines in Lane County that they are hearing positive things from the community members about the couch.
Oh, very good.
So that's
very
great.
Good. Thank you.
And I promise we'll continue to work to figure out why we can't get the audio to work. I
Well,
tested them all yesterday and was very proud of myself. So.
Well, at least I'm sparing you from my acting abilities, which are non-existing. So now at least you know that the spots are produced, and you can go check out the videos on YouTube, and I don't have to read them out loud for you. So.
So thank you very much, Thais and Stacy. So we will not see any other questions or comments. We'll go ahead and move forward, which I think we are now to the Helpline Data and Gear Program update. So this is Greta. Are you there?
Yes, I'm here.
Great.
So just wanted to cover a little bit about the Helpline Data and the Gear Program. So let's move to the next slide. And thanks to Thais and Stacy for their presentation today. And I will just chime in that Roxanne and I did see the video clips from the retailer training, and it's a really great training. So we can't wait for you to be able to see it too. I think it's just so great that our lottery is being so progressive in providing these types of trainings to their vendors. I'm not sure if any other states do anything like that, but I always do appreciate that our lottery is always looking to do new advancements and different things to bring awareness to the fact that gambling can be a problem for some, and setting up those systems within their own system of determining how to refer people to treatment or just to bring that awareness. So we appreciate that. So first, I just wanted to let you know that the helpline data that we received, monthly helpline data, which talks about your the calls that come into the helpline, the web chats that come into the helpline, and the referrals that are made out to the agencies, can all be found on the Oregon PGS webpage under the All Provider tab under Research and Data, and then you'll see that there's Oregon Helpline Data. You'll see if you go to that webpage today that the most current data that we have posted is January 2016, but we will get February's and March on there next week. So, but I just wanted to make you aware of that. Sometimes we get questions from our providers who are doing their own local media campaigns, and they want to look to see if it had an impact on the helpline data calls. They ask for this data from us, but it can be located here on the Oregon PGS webpage. And Roxanne and I will be more diligent in making sure that the most updated monthly data is actually posted on the web. So just wanted to point that out. Next slide. Also wanted to point out that we were having a discussion. Michelle Cantriella Modella Emergent, the helpline program manager, and Shad at the lottery about the GEAR program, and we have recently made the GEAR program more visible on the OPGR webpage, thanks to Shad and a feedback from Michelle. So now you can find, or the public can find the GEAR program under the resource tab of OPGR. And if we go to the next slide, you can also find it under the Help for Gamblers tab under the OPGR webpage. And next slide. And you can also find it at the bottom of the homepage of the OPGR webpage listed here. So in the past, I think it was just under the One Resource tab. It was kind of hidden. And so we wanted to make it a little bit more visible, as access to the helpline, or access to the GEAR program is only available through calling the helpline. And so we just wanted to let people know that we did have a home-based program. And so let's go to the next slide, because I wanted to present some data about the GEAR program. For those of you that may not have known, so this is the data. The blue line on the bottom is the GEAR enrollments, and the green line at the top is the enrollments of just outpatient services. Just to show you a similar trend in ups and downs of enrollment. So if you're not aware, the GEAR program in fiscal year 10-11, that budget for GEAR was completely cut due to budget situations. So one of the reasons we wanted to make the GEAR program a little more visible on the OPGR webpage was because we kind of were rebuilding the program from 2011 when we brought it back. And so this just demonstrates that since the initiation of GEAR in 2001, the program has remained pretty stable with attendings, and we're on the upward trend right now of enrollments. And we don't advertise the GEAR program as much as we did back in the past before it was cut. We used to have brochures that we would hand out and different things, but right now we're just starting with bringing more visibility to the OPGR webpage, and then we'll see where we want to take it from there based on the capacity for the helpline clinician, or the GEAR clinician to serve the GEAR clients. So next slide. So just a little data about GEAR participants. This is the number of participants that we've had over the past 4 years, from 2011 to 2015. And the females that we see more females than we do males in the GEAR program, are significantly more likely to be older than those that receive outpatient services. And so not only are the females more likely to be older, but the clients in general are more likely to be older than those in outpatient services. Next slide. We also see, like I said, the gender. We see far more females in GEAR services than we do males. So this last 2 years of outpatient service, female to male ratio was very close. But with the GEAR clients, we see far more females and than we do males. Next slide. And just other notes of interest from the data that I received from Tom Moore. Those clients that are GEAR clients are somewhat more likely to be separated or married than the outpatient gamblers. And the GEAR clients are significantly more likely to report higher education levels. I think that on average it was about 1.5 years higher than the outpatient clientele. And of course, the last note of interest, significantly more likely to be referred from the helpline compared to other locations. That would also make a lot of sense, because that is how you get to the GEAR program, is through the helpline. So just a little bit of information on the GEAR program, just because we just wanted you guys to be aware that that is a program that we are growing, and has been growing over the past years. We have a really great clinician that has been running that program. If you're not familiar with GEAR, it's a home-based, self-paced manual program that people use, a workbook that they use, and then they get telephone counseling. And Diane, our counselor that runs that program, is now doing some Skype counseling also over the computer. So if you have any questions about the GEAR program, please don't hesitate to contact me, or you can contact the helpline directly by calling their 1-800 number, and you can talk to them about the program also. So it's just a really good program opportunity for those that you might run across in the community that just aren't really ready to seek outpatient treatment or have some barriers. That is a program that they can also use. Sometimes clients will go through the GEAR program, and then they will discover that they are in a little bit of higher need than the GEAR program can provide, and then they will enter treatment later on. So, next slide. So if you have any questions about the GEAR program, like I said, you can either chat in the chat box or question box with Roxanne. You can contact us at any time, or you can just directly contact the helpline, as they would always love to talk to you and share their program with people. Next slide. Okay, so now moving on to our last agenda item. So I just want to talk a little bit about the PGS implementation work plans. So here, this picture on the slide is the PGS System Improvement Plan, the 5-year plan or 5-year plan that was developed and released last fall or early this year. And so this is a high-level plan that talked about different strategies that we were going to try to incorporate. And so what we did is we moved forward and developed implementation work plans around each of the areas within this improvement plan. Next slide, please. So within the improvement plan, there were 6 initiatives: collaboration, workforce development, integration, prevention, treatment, and recovery services, rural services, and funding and reimbursement. So within each of these initiatives, there are different activities, some of them that are currently taking place that we're going to expand upon, and some of them that were new. And what Roxanne and I have done is really gone in and developed implementation plans around these different activities. So these implementation plans are all located on the OPGR, or the Oregon PGS webpage, listed on this slide. And we're currently taking feedback on any additional activities you think we should incorporate around these initiatives until April 30th. So we have a date until April 30th. However, I will let you know that these plans are always going to be working drafts. Let's go to the next slide. And you'll see, so this is a sample of a plan. So you'll see that there's a goal, and then there's an enhanced current activity section. So these enhanced current activity sections, or sometimes they'll be called new initiative sections. What's written in those boxes is what's within the improvement plan. We just transfer that information, and then the action items are the actual things that we are going to try to accomplish. And this is where we would take feedback. Is within these action items. Is there other activities that you think that we could, or actions that we could be doing that goes along with the current enhanced activities or the new activities that are listed? So we're going to be using these documents. The reason that we say this is a working document, and they're kind of always in draft, and so we'll always take feedback, because as we know, this is plans for the next 4 or 5 years, and we don't always know where the future is going. So these documents will always be evolving, and our plan is to review these documents, or these activities within this document, especially the ones that are around the timelines of recent timelines of now, and kind of do status updates and comments and progress notes to let you guys know how we're progressing on this plan. So you'll hear about these implementation plans and on our All Provider webinars, and you'll see notes of progress. You'll see that the status line that is now currently on this particular page, green and blue, might turn to red. And that just means that we're not getting the work done within the time frame that we had hoped. We may move the time sometimes, or we might make it into a red section where our schedule is slipping. You may note that some things might be slipping already, some things may be assigned to our problem gambling treatment specialist position, which we don't currently have. So we're going to be using this plan to hopefully provide some leverage to get that position recruited for and filled again. So going and slipping into the red isn't necessarily always a bad thing because there's only 2 of our staff, and we made this plan based on the fact that there should be 3 staff in our office. So just be aware of that, and some of the dates may not be as realistic as what we had put in here today, so some of them may just change too. Basically, this is our plan. We're taking feedback anytime you have time to review these plans. They're kind of extensive, and have any suggestions on things that we missed, we would greatly appreciate them. Like I said, that we're taking feedback till the end of this month of April. However, we would always be taking feedback on these plans at any time. So just wanted to give you a heads up that the plans are out there and available for comment. So if you have time, go ahead and review them, review sections of them. They're quite lengthy, so don't feel like you need to do it all at one time. All right, next slide. So is there any questions on that? Go ahead and chat in the box, or like I said, at any time you can reach out to Roxanne and I and ask any questions. And I think after that, next slide, I think we've come to the end of our webinar. And these are our contacts within our office. And unless Roxanne has something to add, I think that we can let you go early today. If you do have any questions, we'll stay on the line for at least 5 more minutes to take questions. I think one might have popped up, but it might not be for the whole audience. But otherwise, thank you for your attendance today. Thank you for your patience with our technology issues and our audio issues. And we are going to work very diligently to figure out for the next webinar how to play videos and make sure that there is sound. So thanks again for your patience as we work through that, and all of those clips will be available within the PowerPoint that we send out. And if they're not working within the PowerPoint, we'll figure out another way to get you the video clips. And we thank Thais and Stacy for presenting today with all the stuff they're doing at the lottery. And we hope to see all of you in a couple weeks at the Focus on the Future conference, and if not then, at one of our conferences in the end of September. Anything else, Roxanne?
Nope, I'm all good. Thank you. And there's no questions.
All right. So once again, if you have any questions, just feel free to reach out to us at any time. If you have any feedback for the lottery, you can reach out to us, and we can provide that to the lottery. They're always very acceptant and willing to take any kind of questions and comments that you have. So once again, this is the end of our webinar. We're going to end early. So have a great day and have a great rest of the week, and hope to see you very soon.